to kind of, yeah, talk about yourself a little bit and everything you do.
Thank you, Mayana. What a lovely and kind introduction. I appreciate that. And I guess I want to start by saying, first of all, I'm here representing a really large team of folks that are working on this initiative. So, including I'll tell you more about who. But this work has been going on for a couple of years now. We're entering a new phase and are just really appreciate the opportunity to have some time on your agenda and have conversations with you all. I see some familiar faces as well as some new faces. So just looking forward to the conversation. And my goal really today is to do as much or actually more listening than talking. So I do want to take some time to share with you a little bit about what is the Washington Thriving effort, which has previously been called the Prenatal to 25 Behavioral Health Strategic Plan. So you can see me saying all those words and probably guess why we shifted the language to Washington Thriving, because that was a bit of a mouthful. So I'm going to talk a little bit about what that work is, give you some updates and some information about how to engage if you have an interest in learning more or kind of becoming involved in an ongoing way. But also then have an opportunity for for engagement today and some feedback around a couple questions that we're gathering input on right now. So that's my goal for today. And please flag me down at any time. Happy to take questions if you want to just come off mute, if you want to share questions in the chat, whatever is most comfortable for folks. I'll keep an eye out for raised hands, but really, especially since this is such a nice sized group, really welcome the back and forth and the conversation throughout. So please don't feel like you need to wait till the end for questions. So I'll start off by telling you a little bit about what Washington Thriving is. So this is a statewide initiative that was established in 2023. It was actually the bill that established the initiative was passed in 2022, but the work began in 2023, and it was really in response to the growing behavioral health crisis for young people and caregivers and families in the state. And there's some things that are really unique, I think, and exciting about this initiative, and I want to make sure that I have an opportunity to speak to some of them. But I think really the top of that list is that this initiative was designed from the get-go to be really intended to develop a strategic plan that is centered on the lived and living experience of children, youth, young adults, caregivers, and families in Washington. So the idea is to say kind of when we look at the whole picture of the experiences that young people, caregivers, and families are having in Washington around getting their needs met in the behavioral health space or their needs met for well-being more broadly. How do we need to come together and really develop a coordinated statewide plan? And so that was the goal, to spend this period of a couple years developing this plan through a number of different streams of work that I'm going to speak to as we move through today. We're right midstream, as you'll see as I share some of these updates. So the plan will be shared with the Children and Youth Behavioral Health Work Group, which I'll speak to more in August of 2025. So just a little less than a year from now. And that's the mechanism through which it gets connected to policymakers. So who's leading this work? So this work is nestled within a group called the Children and Youth Behavioral Health Work Group. And I know some of those on the call are really familiar with this group. Some may be hearing about it for the first time. And so on the next slide, I have an image that shares a little bit more about the Children and Youth Behavioral Health Work Group. But for this Washington Thriving work, we have two co-chairs that are leading the process, Representative Lisa Callan and Diana Cockrell, who is the prenatal to 25 behavioral health lead at the Healthcare Authority at the state level. And they are leading the process in collaboration with an advisory group that is called the Washington Thriving Advisory Group, and it includes a wide variety of folks. There are roughly 40 members of this group. It includes direct service providers in behavioral health. It includes youth and young adults, caregivers and family representatives, as well as partners across a number of different state agencies, advocacy organizations, et cetera. And so the idea is that this advisory body is really kind of the key force in leading this work. And this advisory group has been in place for the first year was 2023, and then the membership was expanded this past spring and is continuing to meet throughout the upcoming year into the delivery of the plan in 2025. So I mentioned the Children and Youth Behavioral Health Work Group and wanted to just take a moment for folks that aren't familiar with the work group to kind of understand who that group is and why maybe the Washington Thriving work lives here. So there's a lot of different things going on this screen, but I want to call your attention to a couple things. First is that this group's been around for quite a long time. It was established through legislation in 2016, has recently been extended through 2029, and has done just a tremendous amount of policy work focused on children, youth, young adults, caregivers, and families in Washington state. I'm not going to go into it just for time today, but I'll have in the slide deck that I share with you all after this, just some of the example kind of policy work that the work group has led. They go through a process every year of developing legislative recommendations and including this group includes a number of different subgroups focused on different topical areas. It was the work of this group that really led to the establishment of the Washington Thriving Initiative in 2022. And like I said, the Washington Thriving Advisory Group really lives as a part of this work. So you can see for folks that maybe are a little more think a little more visually, think a little bit in pictures. What we really just want to highlight here is kind of how this fits in. So this is that work group that I was talking about. These are all the different subgroups that exist within the work group, and then the Washington Thriving Group is another subgroup. One of the things I'll talk about as I talk about opportunities to engage is that we have 3 discussion groups as part of this work that happen every month. They are dedicated spaces, one for parents and caregivers, one for youth and young adults, and one for providers and systems partners. Their virtual meetings happen once a month, and those are really the primary way that we're sharing as pieces of the plan are developed. We're bringing pieces to the group, getting input, having some back and forth, making adjustments, and then coming back the next month and saying, okay, here's what we did with your input. Did we get it right? Where do we need to adjust? And so that's a great opportunity to engage folks. Some folks are able to come to all of those meetings. Some are able to just pop in. Sometimes it is not a membership-based group, and we really welcome anyone who can join to be there. And I know I see folks on this call who've been able to join and gather input, which is tremendously valuable. The other piece to just highlight, if folks are familiar or have heard of either of these efforts at the state level, one of the things that the legislation for the Washington Thriving work really highlights is that we need to be connected to the other statewide behavioral health efforts that are happening right now. Two of the big ones I've called out here, which is the crisis response improvement work, as well as the Joint Legislative Executive Committee on Behavioral Health. Okay. So before we move into discussion, there's really just a couple more things I want to share. One is to give you a sense of what's our process of developing this plan and where are we at. So the work that we've done really in 2024 has been focused quite a bit on visioning. So what do we assist if we really center the experiences of folks with lived and living experience, what is the ideal for the future system? What does that look like? What are the principles that would guide that system? And what would the continuum of care or the service array, the range of services look like? We're moving, in some ways, there's none of these phases ever completely finished until we get to the final plan because there's so much iterating and back and forth. But we're really at the phase where we're moving kind of into the assessing the current landscape. So in addition to this visioning work, what's been happening over the last 3 to 6 months is really looking at what exists already. Does Washington have the right support services and supports? We know the answer is no in some places. And so finding out where those gaps are, using both kind of more storytelling focused methods to hear from folks and understand what the gaps are, but also more numbers-based methods to look at where the gaps are. And then really asking the question of, even when there is the right service, do we have enough of it? Is it really meeting the need of young people and families? And then once we get through this fall, we're really shifting gears a bit, and we're moving into then you can see this is kind of like reminds me a little bit of, I don't know, if it's not exactly a Pac-Man, but it's like bringing in all the information, that opening up phase, and then the narrowing down. So as we move into early next year, we're going to be then taking all of that input and saying, okay, how do we come together to build a plan? But one of the really key pieces about this is that all those feedback loops don't end when we move into the right side of the slide. So we continue to have those discussion groups, we continue to have the advisory group meetings, and we have some more intense periods of community engagement next year, as well as pieces of the plan are developed to say, again, okay, here's what we heard, here's how we built it into the plan. Where did we capture things correctly, or what suggestions do you have for improvement? Whew, that was way too much. Sorry, they jumped ahead of me. So I think I won't go into too much detail here. I wanted to include this so you had it for reference afterwards if it was helpful. But another way to describe kind of those phases that you saw before is that we have really kind of the people-centered activities where we're gathering input, success stories, examples, doing listening events, having targeted conversations, and that is in this ongoing feedback loop with kind of the evidence and research components. And so the idea is that they're not existing separately, but there's crosstalk throughout to ultimately kind of move through the phases of this plan. So I wanted to put this up here just as an example for folks to see. This is one of the things, if you've been to a discussion group or an advisory group meeting, you've seen this already. This represents some of the work that we've done in collaboration with partners around future vision for the system. And what you would see if you had joined the conversation at a couple different points over the last 6 months or so, is that it's shifted a lot. We started with some principles, some proposed principles based on the work that had happened last year. And by principles, I mean kind of everything that falls under the prenatal to 25 behavioral health system in Washington does what. We started with that. We got a ton of feedback from folks. We adjusted them. We added what you see on the left. And so this has been one of the pieces that's come out of that feedback loop that I've talked about. So wanted to just put that up here as an example. You can see kind of some of the things that folks have highlighted. For example, having a system that has a clear way to be informed by young people and caregivers and families in an ongoing manner, is able to change in response to that information. So is nimble enough to adapt when we hear input about what's not working, investing in prevention and well-being. I'm not just thinking in that traditional bucket of behavioral health services, but what do folks need to be well, not just in that traditional continuum. So I won't go through all of those pieces, but wanted to give this to you and make sure you had it as a reference point in terms of the kinds of outputs that we're working folks around and in conversations. So next, I wanted to just share a couple of opportunities for engagement, and I'll put these links in the chat as well. But we hope that this presentation isn't the last opportunity to be chatting with you all. We have a couple of different ways immediately that you can engage. We have a website for this effort that's separate from the Healthcare Authority website, and I'll pop that into the chat. You can either follow this link here or go to our website to join the mailing list to hear all the updates about what's happening in the work. I mentioned the discussion groups at the outset. Those are a really great way to engage, and I would, if you're just interested in kind of knowing when they're happening or maybe sharing them with others, you'll hear about that if you join our mailing list as well. And then also just wanted to make sure that folks are aware that there's an invitation for ongoing engagement. If you have a group of folks that come together regularly like this one, that you think have perspectives they'd like to share to inform this planning process, if you'd like to plan an event together, if there are just other opportunities you see where there would be ways to bring folks in and expand the voices that we're hearing from, we really welcome those connections. Like I said, we're doing quite a bit of engagement right now, but that's not going to end. It's going to continue into 2025, and the opportunities will continue as well. So we really hope that the conversation can continue as we move forward. So I'm going to pause there and see. It was a lot of information in a short minute. And curious first, just what questions anyone, and also invite folks who are on the call who also have been connected to this work. If you have perspectives or additions you'd like to share, welcome that as well. But any questions that come to mind kind of right off the bat that folks would like to bring into the space?
Megan, I cannot see hands too. So just if you do have a question or a comment, please feel free to just take yourself off mute.
Thank you.
That
I was
way
just
we
looking
can.
for hands too. Yep.
I know, I was too. So we'll go ahead and open that. And if not, I can ask a couple, particularly of some people here on North Star side.
Yeah.
Yeah, I had a quick question. When it says like
Please.
invest prevention and well-being, what does prevention look like?
Yeah, it's a really great question. My apologies. I didn't see who asked the question. But thank you. Was it MJ, was that you that asked the
Yeah.
question? Yes, thank you. It's a great question. And I guess there's two things I can share. One is that each of these, and I'd be happy to send it out with the meeting materials as well. There's kind of a background definition for each of these that describes a little bit more about what we mean by each of those. And so my short answer is that the intention, based on the conversations we've had so far, is I think of that as encompassing two things, and I think this is what you'll see in the definition. One is recognizing that all across the age span, we need to provide kind of more support to folks earlier on when concerns are identified, and not at the expense of support later on, but really recognizing that we have missed opportunities for providing more support early on. So not necessarily earlier on in the age range only, although that too, but for all across that age span. But the other piece of it is really the well-being piece. So my colleagues who are working closely on this effort around the engagement are not here today. They're from a group called Full Frame Initiative, and their framework is really around kind of really broadening out what we're thinking about when we're talking about behavioral health support. And so the example I will give is that like we had a recent conversation at the Peer Pathways Conference in Yakima earlier this summer, and we're asking folks about needs and gaps around behavioral health. And a lot of what we heard was not about the kind of traditionally what we think of as behavioral health services, right? Folks were talking about kind of community connections. They were talking about support around basic needs. They were talking about all these other things that contribute to well-being. And so that principle is intended to reflect that we're not only interested in kind of the narrowly defined behavioral health services, but what's needed to support well-being more broadly. So that was kind of a long answer, but I will share with you also when I send these materials to Sarah, the definitions, so you can see how it's being defined currently, which will then evolve, right, as we do the roadmap work and actually build out the plan.
Great. And then we did have a comment in the chat that just said, thank you, great job, great presentation. So I wanted to make sure you heard that. Yeah, and any other questions, comments? Again, and Megan, send me everything and anything, because I do pretty detailed notes that live on our website and also go out to our mailing list as well.
Be great. While folks are thinking of questions, I'll put this up as an invitation too, in addition to any clarification questions. If you have input, right, wanted to make sure, since you were all here and we had this opportunity, if you have input as you're hearing about the focus of this plan, of things that you'd like us to keep in mind, I put some questions up here to prompt that. One of the questions that we've heard a lot of great things from folks in response to this question of, if you had a magic wand and there was one thing you could change, add, do with the behavioral health system in Washington that would make a big difference, what would it be? So in addition to clarifying questions, would really welcome any input on that as well.
And if you're not comfortable saying it out loud, you can always put it here in the chat box for us to kind of
Absolutely.
look.
Absolutely.
And I'm
Totally
interested,
fine.
not to put people on spot, but anybody from North Star's team, any insight, this is the moment to kind of capture some of it while we have Megan here with us, which is, again, I really appreciate you coming to the meeting.
Well, one thing I would change about the behavioral health system is just like having them like one provide services when they're requested instead of having to wait in a long period of time, and then also like be able to listen to what the patient needs instead of just being like, oh well, we know what's best for you, like having them actively be part of that treatment plan.
Thank you, MJ.
The one thing that this is Sharon Maggard from Serenity House. Sorry for joining a couple of minutes late. The one thing that I would say about our mental health and behavioral health system is that we really don't have any inpatient care whatsoever. And that is a real detriment to, well, a lot of our homeless and a lot of people that actually live in my housing that really need to receive mental health care. We have a lot of people, because of Housing First, go into housing, and there's no method for me to get them help after they're housed because they refuse it. And I'm trying to work with a few people to discuss how we fix some of those things. So sorry, I didn't mean to take the show here.
Thank you. Appreciate that.
And Sharon, I want to say thank you, please, everybody fill in, and I just to clarify that, and are you also particularly talking about the lack of mental health specific inpatient as kind of that need in the continuum?
Yes.
Great.
We definitely need to do something about inpatient care for both sobriety and mental health.
Yeah, absolutely agree. Mayana, I see your hand up. I can see it. So go ahead and let's hear from you, please.
Yeah. Yeah, I was hoping y'all can see it. I wasn't sure. Yeah, I would say too, and again, this might be very much that magic wand part. But I would
We're
say,
hoping for it. We want to dream big.
yeah, true. I would say, and I'm not really sure the root of this. I don't know if it's under staffing or, I mean, I would assume that would be the biggest reason. I'm not really sure. But I would say, I think I don't know, like prioritizing people who, I don't know, people who need help, they need to be prioritized. I don't really know how else to say it. Like, just like coming from my own personal experience, I can share a brief snippet. When I was in an inpatient facility, I was there for 3 days before I even got to talk to like my personal therapist. So like I was doing like, the group therapy and everything like that. But I wasn't even able to like talk to a person for 3 days. Um, so it just felt like, it really felt like, well, why am I even here? Like, I think, group therapy is great and like it can help a lot of people. But it just wasn't really what I needed in that like time. And so I think really like trying to like, well, first of all, like ask, what people need instead of just assuming, again, and then like prioritizing. Um, and then the other thing too is like, I guess like centering trauma informed care. I feel like that should already be a given without being said. But unfortunately, in my experience, it's not always. And yeah, like I guess it'd be really cool, if you could like, because I think you can, make people go through trainings and get all the education and everything, but you can't really know. I think a lot of times like someone will say that they know something, but then they don't actually like, their actions aren't aligning with that. And so it'd be a super great magic wand moment if you could just like have people go through the training and then like interview them and be like, really, really get into it and ask them, or do some sort of like like, yeah, like screening or something. Because I was definitely like very much gaslit and stuff, and a lot of other things by some of the staff who were supposed to be helping me when I was in an inpatient facility. So it was really just kind of made me feel worse. So I think those would be my magic wand things.
That's story is so helpful. I appreciate your willingness to share it. Yeah, and I'm hearing some things that were echoed by others, and then this piece of even when you get access to care, for example, and you speak the experience you're speaking about, then not getting your needs met even when you're get into that placement, and then the trauma informed component as well. How do we make sure that's actually happening, not just in a training?
Yeah, thank you so much, Mariana. I'm just going to jump in because we have other hands. V, go ahead, up next, and then MJ after V.
Yeah, Megan, I was gonna say your presentation was great, and if there weren't a lot of hands up initially, it's because you did a really good job. Anyways, adding to what Mayana said, I also had experience in like behavioral health inpatient treatment, and there was a lot of isolation that happened in there, and I would say there was a lot of there was a big victim blaming mentality, like, why don't you want to get better? Why aren't you trying hard enough? And I think people often forget that these people are beyond their diagnose, like if you imagine yourself in that place, you just went through so much, right? So it's natural to be angry or really overwhelmed. And then when you're asked, so what do you want to do with your life? What do you envision yourself doing? Like from the get-go, without people really trying to build that rapport with the individual that's seeking help first. It's just like, like imagine like even if you weren't an inpatient, if I just did that to you upon first meeting, it would just be like, why are you doing, So yeah, I would say like if we can like just get everyone to understand like people beyond their diagnose, yeah, I mean, with like mental health, it's such a new thing too, right? Like which is crazy. I think like it's only in like the 2010s when people really start taking it more seriously and started like evaluating like, oh my gosh, like these inpatient places used to be even more toxic and really harmful before. So yeah, I understand it's a new thing. Also, it'd be great if we can start thinking beyond like just like like the technical or like the medical type of mindset. Yeah.
Thank you, V.
MJ, and
Yeah.
then Lori.
Yeah, I was gonna say that I share similar experience with Mayana. Being an inpatient, like for days at a time, we would just be coloring. There'd be no groups. It's just like you get a coloring sheet, or like they would do various makeovers, like getting your hair cut there, but like they didn't really do any really good group work. There was like one thing they did, which was share a TED Talk, and the TED Talk was informative, but aside from that, there was no one-on-one. And then in another time, I wanted to speak with, a therapist one-on-one, and I could barely talk to them for like not even very much more than like 30 minutes, like 35 minutes. And I'm just like, I'm here 24/7 and I can't get the help that I need. Why am I even here? And so like to be able to change those kind of systems and being like, you should be able to talk to a therapist every so often, and like sometimes the group work it's good, but it's not exactly what is needed. And they told me, oh well, if you want to talk about your deeper issues, you should go and see a counselor on the outside. And at the same time, I was only being able to see a counselor twice a month for like only 45 minutes. So it wasn't enough time for me to actually dive deep into my issues. And so it's kind of like a catch-22. Like we don't know like the good service that would actually be beneficial if we're not providing the services that is necessary and that is needed. So yeah.
Sharing, MJ.
Lori, you're up next.
Mayana, do you want to go first? Because my guess is you have something directly related to what's being talked about.
Oh, thanks, Lori. And I didn't see your hand back up.
Oh yeah, no, I appreciate that. Yeah, I'll just add one more thing really quickly. Something, and this might depend, like just, organization to organization, I don't know. But in my experience, there was like we weren't allowed to get very much sleep. Like we had to be up really early in the morning, and to do like all these activities, and then we had to like stay up late to do all these groups till like 11 p.m. And if you skipped out on them, even just because you were tired or you weren't feeling it, or whatever, then you were like, it was like a negative thing, and then they would make you stay there longer because you weren't like cooperating or doing activities, even if you had a very valid reason. And literally, like, sleep, besides how messed up that is in itself, even if you just weren't feeling it, sleep is extremely important for mental health. And like, it's literally a basic human need. And, some people maybe don't need a whole lot, but I'm a person that needs like 9 to 12 hours of sleep a night to feel like I actually got any rest. And like, that's thoroughly studied that like, yeah, that's a thing for a lot of people, especially biological women. And so, and like certain age groups, and I was an adolescent when I was in there, so that's especially, again. And so it was just crazy to me. I was like, why are we only getting 6 to 7 hours of sleep a night as adolescents, when it's researched like scientifically that it minimum is 8, and that's only like if you were to get a grade on a paper, that'd be like a C. It wouldn't even be an A, like that's minimum. And so just like, yeah, it was crazy. And again, not to mention even just like how messed up that would be, even if you just weren't feeling it, that would be like somehow a negative thing. Because like, oh, I could go into a lot of reasons for that, but that's, yeah. Yeah.
Thank you, Mariana.
And we do some
Yeah,
interesting
well-
things on in the chat too, just for everybody to kind of poke in there. And go ahead, Lori.
Thanks. This is such good input. Thank you for sharing your experiences. I am curious because one of the topics that comes up a lot is around the involvement of peers. And I would just love if any of you have thoughts about where, when, how to incorporate peers in different behavioral health kinds of settings or work. And I mean, you don't have to answer, but just because there's so much about building the peer network, I hear a lot of it for adults and peers helping parents. But I'm curious really about the involvement of peers working with young people.
I think peer work is very important, especially like in recovery settings and in the health field. It's been proven that it works, and that like people have, something that they can like kind of fall back to, that they know what you're going through because they've been through something similar. And to have somebody that you can relate to is just really important, because then you're not as alone as you might feel.
So, I'm speaking from like one of the beasts itself. Hi, I'm Jen from ABHU Adolescent Behavioral Health Unit. I think peers I would love to incorporate peers into the programming here. I think that it would be really awesome. I don't know how logistically I could do that, right? But to have a peer, just like a TED Talk, right? I mean, I know not like a TED Talk, but just a peer come in and share their experience, their lived experience with patients on the unit. But then I think about there's so many multi-layers to that. There's confidentiality, or maybe that could be waived, but I think peers are extremely important to the healing process. And I do want to just make a comment. I think if I could wave a wand, I'm just going back to that, and then we could go back to the peer. Yeah, I really think having aftercare services, like really solid aftercare services, because inpatient services are, that should not be the goal. And I know that we can talk about that, and I know that could be a contentious, but we want to heal in the community. We want our communities to heal, and inpatient is I think there's so much churn and so much, we don't want people inpatient, like that's the idea, right? That we need a lot of wraparound services, a lot of peer work. We need so many adequate and good clinicians out there. Family therapy should be just part of Medicaid. Commercial insurance should have wraparound services. Just there's so much. Sorry, so that's just my I just wanted to get it out there. Thank you.
Patty?
Yeah, so I just wanted to talk a little to the peer services piece. I've been up here in Washington for almost 20 years now, as well as another 20 years before that as a domestic violence advocate. So I've been working with families for a bit. And I think the peer services, I've been so grateful to the, acknowledgement that we've gotten for how peer services can just work miracles. They really have been able to provide folks with another avenue. I love my therapy, and I'm never a person who says we need to do one service over the other. I just think integrating peers from the beginning of every service has been the model now that we're looking at in King County anywhere and statewide. And so there's a lot of resources for those of you who don't know how to do that yet, or that haven't got a lot of experience with how to work out all the things like the confidentiality piece and, staffing models and such. And so there's both the peer workforce development team, plus HCA has some specific funding around operationalizing peer support. And then there's a bunch of us out there that have been doing those trainings forever that can help as well. So just really want to, I'll put my email in chat. So if anybody wants more information, I can definitely make some referrals to some of those resources. But the piece about the piece that I think peers do that feels, at least in my experience and, people I've worked with pretty closely, is that piece about offering that hope. Because when we tell our story about where we've been, and especially when we've been in the same facility or a similar facility, and just didn't see our way out, and now we're I'm an executive director of a peer-run organization, and that really, I don't know why my face keeps coming in and out with my camera, sorry about that. But that really makes a difference where they can see it. It's not just somebody telling them about it, right? And we always come from that strength-based perspective where we're not talking about their diagnosis. We're just talking about what their strengths are and how they can use those strengths to better access the services that they're in, access the services they're in and integrate that. Peers are fantastic at getting people to actually participate in services and see the point to it all, because it can feel so robotic. So really appreciated everybody's story that was told today too. So thank you for sharing such intimate parts of your journey. Yeah, I'll put my contact information in chat if anybody, I don't know what's up with my camera, but I'll put that in there. So if anybody has any more questions, I don't want to take too much time, but I think peers are essential at every piece of the road. Yeah. I guess one other thing to add is organizations like mine that do peer services aren't duplicating services, because we're not billing on particular treatment plan or insurance. So we can be there to support people throughout their engagement in other services for the community-based peer organizations, which is really kind of nice for people so that they have some kind of navigator support. So that's the other piece that I think is sometimes overlooked. Happy to talk forever.
Patty.
Patty, just so you know, I'm already putting in my notes, contact Patty about a possible presentation on operationalizing peer support within organizations for
Would love to do that.
Bridge Coalition. So just know I'm coming for you.
Sure. Yeah, I could definitely pull together some of the staff that are doing that now. I used to be the administrator at HCA for the peer support training and all the peer support programs, but I'm not anymore. So I could definitely bring them with me though, so that you're connected right with the person that would be doing it. I mean, I'm happy to help in any way I can, but I think that would be a great way to bridge that. I could do a co-presentation with the people who do the operationalizing peer support or peer workforce development.
That's what I'm thinking, I think. So
Okay,
everybody is hearing it first in real time.
Sure, I can do that.
January or February. So I'll contact you offline for sure. And then I did put my hand up, Megan, sorry, I know we've talked, but I just want to thank everybody for all of the, waving the magic wands and the discussion here. I have to wave mine and just say really adequate, robust funding. I sometimes I don't think money fixes all things, but without sustainable funding, a lot of these things can't come into fruition. And I know just from an individual, I have lived experience. I also come from residential, inpatient, outpatient, ENT programs. I've been involved with pretty much almost every type of continuum of care. And I just know that we need to make sure that we're funding providers, we're offsetting funds so that there's equity within pay. So for Medicaid clients, as well as private and commercial. I really just want to continue to advocate that individuals on Medicaid or who do not have access to private funds have access to quality services. And so let's all, wave our magic money wands. And that's all for me.
Can I interject one thing about that? The latest House Bill 555 actually wasn't just to license peer support specialists, but there was also some bill that alongside of that was about parity for peer support services and wraparound services to be available on regular insurance. And that's a whole process working its way parallel with all the other changes that are happening. So it's an important thing to keep an eye out for, because we should be able to, the hard part is getting off Medicaid and not having peer services anymore. I got to say I know lots of people who've went back and forth just to get the services they needed. So hopefully we can see that coming through in a way that is effective for everybody pretty soon.
Yeah, that's great to hear. And I agree. So I know there's some chats happening in the chat. I'll let you all look at that. I just want to see if there are any other questions, comments, thoughts. Patty, you still have got your hand up, but I'm not sure if that's still up or not. So, okay, perfect. So anybody else? Okay, well, with that,
yeah, I was just going to say,
Meg,
while folks are sharing, just or thinking, if any last comments, just a really a recognition and a deep gratitude for your sharing your stories. I recognize we're all just meeting for the first time in a virtual space, and just want folks to know that the richness that these stories help in our planning, and we recognize that that's a gift that you're giving us, and I appreciate that. And I also want to invite, just please, I will put information in the chat. We would love to continue the conversation, whether it's coming back for another opportunity to share updates with you all as the work progresses, if that's the what works best for folks as well, and doesn't have to be one or the other, but as well as joining some of the other spaces, if that makes sense for you all. And also just feel free to reach out. I'll put my email in the chat. If you have input that you'd like to share over email or in a one-on-one conversation, we're happy to do that as well. But thank you for your engagement and your time. I know it is both are precious, so appreciate you all.
No, thanks so much, Megan. And yes to coming back with updates, as well as other engagements. Great. And I'm going to stop recording on that. And V, you're up next.